Before I start my assessment, I always make sure that the area is safe and I just wash my hands. So my name is Bernice and I'll be doing a complete assessment on you today. And can you just tell me your name, your age, date of birth, and why you're here?
My name is Anna. I'm 19. I was born in October 7, 93, and I'm here for my annual physical.
Okay, good. Patient appears stated age. Patient is alert and oriented ×3. Patient is, the skin color is brown and consistent with genetic background. And the skin is warm, dry, and intact. No lesions noted. And patient is sitting erect and upright. Patient's facial expression is calm and without distress. And the mood is pleasant and the affect is appropriate for the situation. Patient is well nourished, well developed. Patient is clean, well groomed, and her speech is well articulated, and the pattern of her speech is fluid. The content of the conversation is appropriate, and her native language is English. She hears and responds appropriately to the conversation. No obvious physical deformities noted. Now I will just assess the fingers and the hands. No biting, clubbing, or discoloration. The nail beds are pink and firm, and the cap refill is prompt, less than 2 seconds. No lesions noted. And now I will assess the face and the head. I'm just going to put my fingers in your hair a little. No scaling, parasites, no discharge or crusting noted. Any tenderness? No tenderness. The head is normal cephalic. And now I'm going to assess your face. So if you could just smile for me. Good. And puff your cheeks. Good. That assesses cranial nerve 7. And now I'm just going to assess your temporal artery. Okay, it's symmetric, +2 bilaterally. Can you just open your jaw for me? Okay. No slipping or crepitation of the temporomandibular joint. And so yes, the face is symmetric, no weakness, no involuntary movement. And now I'm going to assess the maxillary sinuses. And now the frontal sinuses. Any tenderness? No tenderness noted. Now I will assess the eyes. First I will assess by confrontation, so if you'll cover your left eye, I'll cover my right. And just let me know when you see my hand coming in from the peripheral.
No. No. No.
Okay, and other eye?
No. No. No.
Okay. The peripheral fields are full by confrontation. Now I'm going to assess the extraocular movements of the eye. Extraocular movements are intact. And now I'm going to just look at the cornea. And I'm going to get my pen light. The corneal light reflex is symmetric in both eyes. The pupils are 3 millimeters dilated and constricted is 2 millimeters. Now I'm going to assess the 6 cardinal positions of gaze. So just keep your head straight ahead and just follow my finger. Okay, this shows that cranial nerve 3, 4, and 6 are intact. And it also shows parallel tracking of the eyes. The visual field confrontation showed that cranial nerve 2 is intact. And now I'm going to just assess the external structures. No ptosis, lid lag, or drooping. No discharge or crusting. The eyebrows are symmetric and the eyelashes are evenly distributed. And now I'm going to look inside the eye with the ophthalmoscope. And I'll look inside this eye, sorry. The red reflex was noted. The optic disc is flat with sharp margins. The vessels are present throughout all 4 quadrants, and the retinal background is even color with no hemorrhaging or exudate. The sclera is white without lesions. The conjunctiva are pink, and they are moist and they're clear. The irides are round and equal bilaterally. And now I will assess the ear. Just gonna feel first. Any tenderness? Can you feel this one? Any tenderness? No tenderness noted. And now I'm just going to look inside with the otoscope. The ear canal is clear. The tympanic membrane is pearly gray with no perforation, and all landmarks are intact. There are no foreign objects in the ear canal. Now I'm going to assess the hearing, which will assess cranial nerve 8 with the whisper test. I'm going to whisper 3 words, and you're just going to repeat after me. You're just going to put your finger in your ear, just like that. Box happy. Good. Next ear. Dog, cat, fish. Dog, cat, fish. Good. This shows that cranial nerve 8 is intact. Now I'm going to assess the nose. No obvious deformities of the nose. And do you feel any tenderness?
No.
No tenderness noted. And now I'm going to look inside your nose. The nostrils are pink with no lesions. The septum is midline with no perforation. The turbinates are red with no swelling or exudate. Now I'm going to occlude one nostril and let me know if you can breathe through the other one. Okay. Yes. Okay, the nares are patent. And now I will look inside your mouth. Say ah. Say ah. There we go. Now I'm gonna just look inside the palates. Okay. Okay. The mucosae and the gingivae are pink with no lesions, and the gums are intact with no bleeding. The tongue protrudes midline and it's symmetric and pink. And the anterior palate is rougher looking, it's pinkish whitish, and the posterior palate is more smooth and more pink. Also, there are no teeth missing, and the tonsils are 1+, and the uvula rises on phonation, which shows that cranial nerves 9 and 10 are intact. And I'm going to assess the gag reflex. Okay, gag reflex is intact. That shows that cranial nerve 9 is intact. And now I will assess the neck. So let me know if you feel any tenderness. Any tenderness? No tenderness noted. No lumps or lymphadenopathy. The neck is symmetric and supple, and now I will assess the cervical lymph nodes. Preauricular, posterior auricular, occipital, submental, submandibular, jugular-digastric, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. No lumps. Did you feel any tenderness? No tenderness noted. Now I'm just going to assess your trachea. Trachea is midline. Now I'm going to assess your carotid artery. It's 2 plus and equal bilaterally. Now I'm going to see if you have any bruise. No bruise noted. And now I'm just going to ask you to follow my motions. Okay. Now press against my hand. Okay. Okay. Strength is good and strong and equal bilaterally. And I'm just going to ask you to shrug your shoulders. Okay. This shows that cranial nerve 11 is intact. And now I'm going to pause to reposition. I'm going to continue the assessment by palpating the thyroid. If you'll just lean your head forward a little bit for me and a little to the right. Okay, I'm going to displace it a little bit and just swallow. Okay, and one more time, I'm going to do the other side. Okay, no nodules, or is it tender? Mm-hmm. Okay, the thyroid gland is not enlarged and there is no tenderness. Now I'm just going to assess the posterior chest. I'm going to assess the posterior chest, and I'm just going to inspect first. The anterior posterior is less than the transverse diameter. The skin is brown and consistent with genetic background. And the skin is warm, it's dry and intact. The turgor is elastic. I'm just going to look and see if the bottom is intact, if there's any lesions. No lesions, and skin is also warm, dry, and intact. The thorax is symmetric, and the ribs slope downward. Just going to look at the ribs. The ribs slope downward, and now I'm going to first I'm going to feel for tactile fremitus. You're just going to repeat after me, or just say 99 each time you feel my palm against your back.
99, 99, 99, 99. 99, 99, 99, 99, 99, 99.
Okay, tactile fremitus is symmetric bilaterally, and it decreases as you go down the chest. And now I'm just going to palpate for any lumps. Any tenderness?
No.
No lumps or tenderness noted. Now I'm just going to feel the spinous processes. Let me know if you feel any tenderness. Lift up the shirt to feel the rest. Spinous processes are in a straight line and no tenderness is noted. Now I'm going to percuss. Resonance predominates. And now I'm going to check for diaphragmatic excursion. I'm going to get my ruler. Okay. First, I'm just going to have you exhale. Okay. Okay, now just inhale and hold it. Now I'm going to measure with my ruler. Diaphragmatic excursion is 3 centimeters. And now I'm going to check for symmetric expansion. So I'm just going to have you take a deep breath in. Okay, good. The thorax expands symmetrically. And now I'm going to check for CVA tenderness. Let me know if you feel any pain. Okay, no CVA tenderness noted. And I'm going to listen to the breath sounds. Just lean forward slightly and breathe through your mouth. Okay. The breath sounds are clear and vesicular bilaterally. There are no adventitious sounds. And now I will assess the anterior part of the chest. So now you can just, just like that is great. Okay, so first I'm just going to observe. Respirations are even and unlabored, and the skin is consistent with the genetic background. It's warm. And the turgor is elastic. There are no lesions and no cyanosis or pallor. And now I'm going to do tactile fremitus on the anterior chest. So just say 99 when I put my hand here. 99, 99, 99, 99. Okay.
99.
Okay. Tactile fremitus is symmetric bilaterally, and it decreases as we went down the lung field. And now I'm going to percuss. Okay, resonance predominates, and now I'm just going to palpate for any lumps or tenderness and let me know if you feel anything tender. No tenderness. Okay, and now I am going to check my card and make sure I got everything. I'm just going to listen to your breath sounds. Just going to have you pull up your shirt again one more time. Okay. The breath sounds are clear and vesicular bilaterally, no adventitious sounds noted. And now I will test the range of motion of the upper extremities. So, first, I just want you to put your hands way up as far as you can go. Okay? Can you put them behind you as far as you can go, like that? Okay? And do like this. Okay, good. And now let's do it behind your head, like this. Okay? Now just put your hands up like this. Okay, and now put them all the way down at your side. Good. Now just do like this. And just follow whatever movements I make. Okay, and do like this. Okay, good. Now I'm going to test the strength. So pull against my hands. Okay, good. Now push. Well, put your hands like this and then push against my, there you go. The strength is strong and equal bilaterally. Now I'm gonna assess your epitrochlear node. So just pretend like we're shaking hands. I'm just gonna feel right here. Okay, the epitrochlear nodes are not palpable. And now we will pause to reposition. Okay, now I'm just going to have you move to 45 degrees. Okay, maybe rest your head up on this thing here. And the jugular venous pulse disappears at 45 degrees. Jugular venous pressure is not indicated at this time. I'm going to feel for any thrills. No thrills noted. I'm going to assess the apical impulse. The apical impulse is present at the 5th intercostal space in the left midclavicular line. No pulsations or heaves are visible. No abnormal pulsations or heaves. And now I'm going to listen to the heart rate. Heart rate is 64, the rhythm is regular, and S1 and S2 are not accentuated or diminished. S3 or S4 is not noted. Now I'll continue with my abdominal assessment. I'm just going to have to pull up your shirt. Okay. The abdomen is flat and symmetric. The umbilicus is midline and inverted. No inflammation or discoloration. No hernia or pulsation. And the skin is brown. Sorry, it's warm, dry, and intact. My hands are cold. And no striae or lesions noted. And now I'm just going to listen to the vowel sounds. Okay. Vowel sounds are present and active in all 4 quadrants. Now I'm going to listen to the vascular sounds. No bruits or vascular sounds noted. And now I'm going to percuss. Okay, tympany predominates. Now I'm going to assess the liver span. I'm going to get the ruler. I have to mark it here. The liver span is 7 centimeters. Now I will percuss the spleen. And the liver is in the right midclavicular line. Inhale for me and hold. Okay, the spleen is not enlarged. So now I can go ahead and do light palpation. And deeper palpation. No masses or organomegaly noted. And now I'm going to just palpate the liver border. Just going to have you inhale and then exhale. Okay, one more time. Okay, the liver border is just palpable, and I'm going to palpate for the kidney. It is not palpable, and the aorta is felt palpating just left of the abdominal line here. And now I'm just going to palpate. I'm going to palpate the spleen, see if the spleen is palpable. It is not palpable. The abdominal reflexes are not indicated at this time, so I will move on to the femoral pulse and inguinal nodes. For patient privacy, I will just palpate above this close. And the femoral pulse is 2+. The inguinal nodes are not palpable. Now I'm going to move to the legs. Just going to pull up your pants here. The legs are symmetric. They're both brown and consistent with genetic background. They're warm, dry, and intact. The hair distribution is even, and there's no pretibial edema. Now I'll assess the pulses. Dorsal pedis pulse is 2+, and the posterior tibial is 2+ as well. I'm going to see if I can palpate the popliteal. They are not palpable bilaterally. And now I'm going to see if you can feel your toes moving. Just close your eyes and let me know if it's up or down. Down. Up or down? Down. Up. Down. Up. Down. Up. Okay. And now I'm going to just see if you feel sharp and dull. Sharp. Sharp. Dull. 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 Okay. This shows that the patient's sensations are intact. And now I'm just going to review my card and make sure I got everything. Okay, yep. And now we will pause to reposition. We're now going to continue by assessing range of motion of your hips. So if you could just open your hips wide, okay, and lift your left hip up, other one, okay, now push against me, both sides, okay, now push down, okay. Strength is equal bilaterally and complete range of motion of the hips noted. Now we're going to check the knees. So if you'll just flex your knee like that, okay, other side. Okay, any tenderness?
No.
No tenderness noted. I'm just going to look at the knees. Okay, distinct cavities are present. Okay, distinct cavities present. And no lesions, no lumping, and the skin is intact. And now the ankles, can you just twist your ankles like this? Okay, now put your feet up and down. Okay, good. Complete range of motion noted. The ankles are equal size, and the feet are symmetric bilaterally. Any tenderness? No tenderness noted. Okay, now I'm going to assess the position sense. So I'm gonna ask you, just close your eyes, and I'm gonna see whether you know whether your finger is up or down. Okay, good. So position sense is intact, and now I will check sensation. So close your eyes and let me know when you feel something on you. Sensation is intact on the arms, hands, and legs and feet. And now I'm going to put something in your hand, and you're going to let me know if you can tell me what it is. Close your eyes. Okay. And now I'm going to I'm just going to check your reflexes. So you can open your eyes. I'm going to check the biceps reflex. Okay, 2+. And now I'm going to check the brachioradialis reflex. Okay, 2+. And now I'm going to check the Babinski reflex. It is not present, which is expected. And now I'm going to check the triceps reflex. Just relax your arm. And a reflex of 2+ is noted. Now I'm going to check the Achilles tendon. Okay, a reflex of 2+ is noted. Now I'm going to check the patellar reflex. Oh wow, that was a good one. 3+. And now I will have you walk across the room for me. Okay, good. And now can you walk heel to toe? Good. Now can you walk on your tiptoes? Okay. Now can you walk on your heels? Good. And now can you touch your toes for me? Okay. And now you can stand up. And can you, so this shows that she has full range of motion. And now I want you to I'm just going to have you stand still, but if you could put your feet together and close your eyes, we're going to make sure your balance is good. Okay, balance is intact. And so now I'm just gonna have you sit down again, and I'm gonna have you touch your nose and then touch my finger, and we're gonna do this, you're gonna just do it slowly and then rapidly. Okay, good. And now if you can just touch your heel to your shin. Okay. Okay, good. That shows that the finger to nose and the heel to shin show that cerebellar function is intact. And so now I will just check my list to make sure I got everything. Okay, well, before we finish, I will just have you do the shallow knee bend. So if you'll just stand for me, please, and just bend with your knee like this. Okay, other side. Okay, good. Balance is intact and full range of motion is noted. Musculoskeletal system is intact. Thank you for your time.
Thank you.